High blood pressure is known as the silent killer. It's silent because it usually comes with no symptoms. So, unless you get it checked, you're usually unaware that you have it. And it's the silent killer because it puts you at risk of early death from heart attack, stroke, kidney failure, dementia, including Alzheimer's type. I think a lot of us imagine that we'll always have our health until the day that we don't. And that's the day the doctor might prescribe pills for this or some other chronic disease and tells you that you need to take these pills for the rest of your life. Today, we'll be talking about not just how to lower your blood pressure, but normalize it with the side effects of feeling more energetic, sleeping soundly, changing your health trajectory, and even living longer. I'm Dr. Vivian Polak, and I'm an MD with training in whole food plant-based nutrition for disease reversal. I think it's our greatest failing in Western medicine that we don't teach this to every doctor. But sadly, most doctors actually know nothing about the science of nutrition. Yet, another bonus from eating this way is you can hugely reduce your risk of getting other chronic diseases or even reverse them too. Diabetes, cancer, autoimmune diseases, the list goes on. And perhaps the best news for many of you is eating this way will help you arrive at your healthy weight without even trying. But more on that in a future episode. We'll also talk about the number one most important thing you can start doing right away to not just lower your blood pressure, but to have the greatest impact on your overall health and well-being, as well as adding years to your life. So be sure to listen for that. Okay, let's dive in.
Women are battling more and more chronic diseases, and it breaks my heart that they don't know they could get to the root cause and become healthy and well. Anyone can do it. I'm Dr. Vivian Polak, and I'm on a mission to help women worldwide embrace the most healing plant-based nutrition and lifestyle in a supportive community of compassionate women. Welcome to Reversing Diseases, where transformation begins on your plate.
You want to see the world's shortest list? I have a list here of women who need more than just nutrition to normalize their blood pressure. So for those of you watching on YouTube, you can see the list that I'm holding up now. There is one type of woman on the list, and you can see it says those with a secondary cause, something that is causing their blood pressure other than food and lifestyle. But you know what types of women can lower and normalize their blood pressure and even get off their blood pressure medications? Women who've said they have too many food sensitivities to eat plant-based, women who've said they only ate fast food, women who thought they were too old for it to be worth changing, women who said no one in their circles eat like this so they can't do it on their own, and many more. In my opinion, it's never too late to feel better. You know, even if you have what the doctors call terminal cancer, it's never too late to feel better. You can get some of your energy back and improve your quality of life. So if you really want to optimize your health and how happy and well you feel, then this way of eating, this gift really is for you. But don't worry, you don't have to think of never having your favorite foods again. That's too scary for most of us. It can be one meal at a time, one bite at a time. And you may or may not know that human taste buds change very quickly too. And in no time, you'll actually crave the foods that are healing you. Of course, always check with your doctor before you change your diet or lifestyle, especially if you have any medicated illnesses. Your doctor might actually want to change some of your medications or reduce medications even before you start. This goes for things like insulin, for example. Many doctors will actually cut your insulin dose in half before you start eating this way. That's how fast it works. It is so effective. But many of you will want to just change slowly, and that's totally fine too. Whatever works for you. You know, I tell my clients that this is for the long haul. If you want to feel fantastic and have amazing health, then this is the way you want to eat in the long term. So if you need to go slowly at first, that's totally fine. Whatever makes it tolerable and doable for you, that's what I recommend. I'm really excited to share this with you. This is a brand new podcast, especially for women who want to optimize their health, reverse chronic diseases whenever possible, live longer, and feel fantastic right up until the end. In this episode, we're going to talk about what high blood pressure is, how you get it, and how you can reverse it. In Western medical schools, regarding all the chronic diseases that most people around the world die of, we are taught how to manage them. In this podcast, however, our focus is on reversing them whenever possible by starting with whole plant foods, which seems to be the fundamental element needed to reverse most reversible diseases. If you have high blood pressure, maybe you're on a medication or several, and your doctor has told you it's for life, which a lot of women don't like to hear. Whether it's the side effects, the insurance premiums, the change in travel plans, or just not liking the idea of having to be on medication lifelong to protect you from dying prematurely. And having had to take blood pressure medications myself, I get it. I had dreadful side effects when I took these medications before we could finally confirm my correct diagnosis, which, by the way, was a reversible cause and actually the commonest secondary cause of high blood pressure and a frequently misdiagnosis. But more on that another time. So, what is high blood pressure? Why is it called a lifestyle disease? And how can you get rid of it? When you eat the Western diet, high in meat, dairy, eggs, and recreational foods or processed junk with lots of salt, sugar, and fat, studies have shown that we start to develop fatty streaks in our arteries by the age of 9 or 10. In our teens and 20s, we start to develop the next stage of heart disease, which is called fibrous plaque. So, eating the Western way, which has been popularized all over the world, starts the process of clogging arteries in childhood. When that space is getting clogged, it's getting narrower, which means the pressure inside the blood vessels goes up. In addition, people who eat meat, dairy, and eggs have thicker or more viscous blood, and that also increases blood pressure. If you think of drinking a thick smoothie, you're going to use a thicker straw. Otherwise, it's going to take tremendous force to drink it through a thinner straw. And it's the same with the arteries. Furthermore, the high salt draws more water into the arteries, which, you guessed it, increases blood pressure. Whereas eating plant-based increases potassium in the blood. And by various mechanisms, this actually decreases blood pressure. Then if you keep eating all the animal products and processed junk, which means a whole lot of superfluous cholesterol, because we build the cholesterol we need right in our bodies, and also all that extra salt, the plaques get so saturated that they actually start to crystallize into these pointy needle-like structures. And then boom, a chunk breaks off and you have your first heart attack. A heart attack is a total blockage in one of the arteries around your heart, or coronary arteries, that carry oxygen and nutrients to the heart muscle so that the heart muscle has the strength to pump blood all around your body and brain. So when you have a heart attack that blocks the blood supply, part of your very important blood pump, which allows you to do all the things you want and need to do, like run, dance, hike, hold babies, go up and down the stairs unassisted, play soccer with your children and grandchildren, it dies. Hopefully, it's just your first heart attack and not also your last. But some people have this blockage in a place called the widowmaker, a certain artery, the LAD, the left anterior descending, and it's called the widowmaker because they're first heart attack is also their last. Over half of people who will eventually die of heart disease, which is the commonest cause of death on the planet, will have SCD as their first sign of heart disease at all. And SCD is sudden cardiac death, meaning the first indication that they have heart disease at all is they have crushing chest pain and they die. So tragically, their first heart attack is also their last. And I think we probably all know someone or even many people this has happened to. And very often they leave behind children, partners, and many other loved ones. A chunk can break off and puncture an artery wall. Wall makes it sound like such a sturdy structure, doesn't it? But artery walls, if you think about, they're only like half a millimeter, maybe a millimeter thick. And the capillary walls, like in the smallest arteries in the fingers and toes, etc., are 1 cell thick. So this can cause a tear in the body's biggest artery, the aorta, for example, called an aortic dissection, a very painful medical emergency. About 1/3 are misdiagnosed, about half don't make it. And about 1/3 of these happen in women. Having high blood pressure can also lead to a blockage in an artery in the brain. This is called a stroke. So then, of course, a section of brain tissue dies. Now, some people have silent strokes and silent heart attacks, meaning they don't have any symptoms at the time, but still part of their heart muscle or a part of their brain is dying. And when this happens in the brain, this can lead to dementia, vascular dementia, and also Alzheimer's dementia. Alzheimer's dementia is also sometimes called type 3 diabetes. So, what is blood pressure? There are two forces of the heart that create blood pressure. The top number, which is the systolic pressure, that's the force of the heart pumping blood out to the rest of the body. And the diastolic number, the bottom number, is the heart relaxing. Both are very important. When blood pressure is too high, it can cause not just heart attack, stroke, and dementia, but also damage to the arteries in the brain, causing aneurysms. So, for example, you get an outpouching of an artery in the brain, and so that's a weakened artery wall, and you can have ruptured aneurysms and have a different kind of stroke, which is a bleeding stroke or hemorrhagic stroke. And the first symptom of that is typically the most painful headache of your life. High blood pressure can also cause damage to other organs too, like the kidneys, and they can cause kidney failure requiring either a transplant or dialysis. Dialysis traditionally has been done in hospitals where you get hooked up to a dialysis machine for several hours, 3 times a week. Some people can have a kidney transplant, which means they have to take very strong anti rejection medications for the rest of their life because the immune system sees this as a foreign body and is trying to get rid of it. So you need to dampen the immune system so that your body doesn't want to reject the kidney. High blood pressure can also damage the eyes, leading to blindness. So it's really not a benign disease that you'd want to just ignore. Okay, enough bad news. The good news is this does not have to be your fate. Studies have shown over and over and over again, since at least the 1930s, that eating a diet without animal products doesn't just prevent high blood pressure and many other chronic diseases, but in many cases, it can completely reverse them. They taught us in medical school that blood pressure just simply increases with increasing age. But I've learned that that's not true. There are studies that have been done that show that in countries where they naturally eat plant based, their blood pressure either stays the same throughout life or it even decreases. And by the way, I'll be putting studies like references that I'm talking about during this in the show notes. So you can refer to them if you want to look at the research. I'm thinking of studies in China and in Africa where blood pressure stays at about 110/70, or it reduces from like 120 to 110, 105 over 70. Fascinating. It's just not what we're taught in Western medicine. In Western medicine, we just accept that it increases because that is what we see here. Eating this way also does you other favors as well. It reduces your risk of a whole host of other chronic diseases and will even reverse them, like I said. So, diabetes, high cholesterol, heart disease, menopausal symptoms, polycystic ovaries, fibroids. I mean, just so many disease, lupus, Hashimoto's, an autoimmune thyroid disease, Crohn's. These can be reversed, and it gets even better. When you eat this way, you have amazing energy, mood, sleep, cognition or memory and thinking, menopausal symptoms, headaches, including migraines, acid reflux, constipation, irritable bowel syndrome, irritable bowel diseases, so many things. Now, one thing is there are sometimes secondary causes of high blood pressure that, like I mentioned at the start, require more than just a change in diet. I was found to have sky high blood pressure of 220/110 to 114 when I was 43. I had no risk factors for high blood pressure. I was pretty slim, no family history, non-smoker. Long story short, I had the commonest secondary cause of high blood pressure or hypertension, which is primary aldosteronism or primary hyperaldosteronism. But it took 8 months to diagnose me. And if I hadn't have been doing my own research to try to figure this out, I'm pretty sure I'd still be on medication and not cured and not feeling great. The form I had was one-sided, meaning I had a tiny benign adenoma or tumor, like mass, in my left adrenal gland that was pumping out aldosterone, a hormone that causes high blood pressure and other changes in the body. And I was so symptomatic. We have little glands that sit on top of our kidneys. This is really important to know because at least 10% of all people with hypertension have this primary hyperaldosteronism, and it's completely curable in at least half the cases. Some people have it on both sides, so that may not be curable, but you can be put on a certain type of blood pressure medication that will help you feel a lot better. Actually, when we discovered what my diagnosis was, that was the medication I was put on, and all my headaches and migraines completely disappeared in those 2 months prior to surgery. Primary hyperaldosteronism is woefully underdiagnosed for such a common condition that has such drastic side effects and complications. So be sure to go to your doctor and make sure secondary causes have been ruled out. Make sure the explanation your doctor gives you is logical and really makes sense to you. And if it doesn't, you might want to go back to your doctor with an advocate so you can ask all the questions that would make sense. Medicine really is very logical. And so if it doesn't make sense to you, it's possible that it just doesn't make sense. So you might need to ask for a second opinion. You know, doctors can make mistakes. We are only human. So if you're not convinced of the explanation, be sure to bring an advocate with you or get a second opinion. You might want to get a referral to an internist who is a doctor who specializes in diseases of adults. There are other secondary causes of high blood pressure as well. So do be sure to talk to your doctor and make sure they've been considered. And if There are possibilities that they've been ruled out. Now, by far the commonest cause of high blood pressure is food and lifestyle, but especially food. So it's not too surprising that changing what you eat can change your blood pressure and normalize it in most cases. It happens pretty fast too. So make sure you do talk to your doctor if you think you want to eat this way, so that you can work closely with your doctor to manage your medications, since your blood pressure will probably start to decrease. If you don't start decreasing your medication, then you can start to feel dizzy. And, dizzy is okay, but falling down and hitting your head on the coffee table or falling down the stairs, that's not okay. And it's funny, decreasing medications now has a name. It's called deprescribing. And lifestyle medicine doctors have to deprescribe all the time because eating this way makes you healthy. So, do you see that what you put on your plate can set you up either for a long, healthy, vibrant life, or a growing collection of chronic diseases and medications to help treat them, and maybe more medications to help treat the side effects of the first ones? I hope this episode has opened your eyes and inspired you to start using the incredible healing power of food as medicine. But many people have told me that they just don't know where to start. And others have told me that they've tried eating this way, but it didn't work for them, or they ran into problems of some sort. I want to help all of you. So I've created an email course for you, and it's totally free. So if you want to learn to eat for your best health, just go to eatforyourbesthealth.com and sign up. You'll get a series of automated emails with a step-by-step process of what to add to your diet. This will help you start to naturally crowd out the not so good for you foods. So you don't have to think about cutting anything from your diet. You'll also get some great recipes and tips for helping you switch. I hope you have a lot of fun with it. And please share the link with all your friends and loved ones. That's eatforyourbesthealth.com. Again, it's eatforyourbesthealth.com. Also, I would love to hear from you. So if you try the course, or even if you just try eating this way, please let me know how it goes for you and what changes you see, whether just positive changes in your eating habits, your cravings, your taste buds, or your symptoms, or all the way out to reversing diseases. Whatever it is, it's all super inspiring, and I'd love to hear it all. Now, some of you may already know what to do, but you're feeling kind of stuck, and I want to help you too. I'm thinking we could maybe do a win-win exchange. I'd like to do some coaching in future podcast episodes. I think that could be a really useful and fun way to help a lot more women switch to eating this way. It's such a challenge for so many people to make this switch. So if you're open to your coaching session being recorded for a future public podcast episode, just go ahead and book a 15-minute coaching call for a donation to the nonprofit of any amount. You can pay $5, $500, or even $1. Whatever amount you give will be put to good use to help others. I'm not going to sell you anything on this call, but I can usually do only one of these calls per week. So if you're stuck or you have one problem that you want some help with, just sign up for a Donate What You Want coaching call. And you can check the show notes for how to make that. Whatever you choose, I look forward to hearing from you soon with your challenge or your success story. Okay, so I wanted to share with you the one thing you can start doing right away to help you lower your blood pressure, improve your health overall, have more energy, sleep better, and even live longer. The food I'm talking about is greens. It's no secret that greens are basically a superfood. Dr. Caldwell Esselstyn, who is an expert in severe heart disease, he suggests eating greens 6 times a day to keep the arteries open or patent, because they contain a lot of nitrates, and so that will help to bathe the arteries in nitric oxide. Now, greens don't just keep the arteries around the heart open, but all over the body, of course, including the brain. So greens can also increase blood flow to the brain, which improves cognitive function, memory, thinking. So if you feel like you have brain fog, eat more greens and see what happens to your thinking. Greens are also really important for your eye health. Even just 2 servings a month will cut your risk of glaucoma in half. But if you have lighter eyes or you take calcium or iron supplements, then you need even more. And of course, I'd recommend much more than just twice a month if you want optimal health. For breast cancer in premenopausal women, the most protective vegetable is, maybe not too surprisingly, broccoli. And for women of all ages, the most protective vegetable is collard greens. These are both cruciferous greens and have amazing healing power. Greens have also been shown to lengthen telomeres, which are like the protective ends of our DNA strands. You can think of telomeres like the protective ends of shoelaces, the plastic ends of shoelaces. Well, once that starts to break down, the shoelaces don't last very long. they get old and die. Just like our telomeres, as they get shorter, which usually happens with increasing age because of, oxidative stress, inflammation, etc. But you can actually lengthen your telomeres with an enzyme called telomerase. And guess what boosts telomerase activity? You got it, greens. It's amazing. One study showed that 1.25 cups of cooked greens, which in that study was kale, broccoli, cauliflower, and collard greens, boosted telomerase in guess how long? It was 5 days. They thought it would take a few months, but it was only 5 days. Incredible. I could go on and on about the amazing healing power of greens, but there is one note of caution. If you are prone to kidney stones or you have osteoporosis or low bone density, then you need to be careful with 3 greens. These are spinach, Swiss chard, and beet greens. The reason is they're very high in oxalates. And for that matter, you would also want to avoid taking vitamin C tablets because vitamin C is actually metabolized into oxalate. Just eat your fruits and vegetables. Now, if you have osteoporosis and you eat high oxalate foods, then that will decrease the absorption of calcium, and you don't want to do that if you're trying to increase your bone density because oxalates inhibit calcium absorption. The best calcium-rich foods are greens and beans, so you definitely do want to eat lots and lots of greens, just not those 3. If you've enjoyed this podcast, remember to hit the subscribe button so you'll catch the next one, and be sure to share it with at least one other woman who needs to hear it. And I'll catch you in the next episode.